So today's question is, can you explain agoraphobia? Well, agoraphobia is a psychological disorder that manifests as an intense fear or anxiety of being in situations or places where escape might be difficult or help might not be available if a person experiences a panic attack. Now, the term agoraphobia is derived from two Greek words. The Greek word agora, meaning public place or marketplace, and phobia, meaning fear. But it's not limited to a fear of open spaces, because the condition can also involve fear of being in crowded spaces, fear of standing in lines, fear of using public transport, or simply being away from a safe or familiar environment. Now, agoraphobia typically begins in late adolescence or very early adulthood. But having said that, it can develop at any age. It's more common in women than it is in men, and the severity of the condition uh, can differ from person to person quite significantly. So symptoms of agoraphobia will be actually, let me put them on screen, and you can pause the video and read them. There's quite a few. Now, the exact cause of agoraphobia isn't really well understood, but it is believed to be a combination of genetic, biological, and environmental factors. Some individuals with agoraphobia have a history of panic disorder or panic attacks, which can contribute tremendously to the development of the condition. Treatment for it usually involves a combination of psychotherapy and medication. Cognitive behavioral therapy is a common approach, which focuses on identifying and changing negative thought patterns and behaviors. Exposure therapy, which is a component of CBT, involves gradually facing and confronting the feared situations or the places in a safe and controlled manner. As far as medication goes, antidepressant and anti-anxiety medications are sometimes prescribed to help manage the symptoms and facilitate progress within therapy. But, with proper treatment and proper support, many people with agoraphobia can learn to manage their symptoms, reduce their anxiety, and gradually regain the ability to engage in everyday activities. But, it's a pretty brutal disorder, and I think it's one that is grossly misunderstood. A lot of people think that agoraphobia is just, fear of open spaces, but it's so much more than that, so much more complex than that. Anyway, that's what it is. That's what agoraphobia is.